Hey there. So today is the 3-week anniversary of my surgery. It's the 31st. My surgery was on the 9th, and recovery is going great from that. I'm healing up from the surgery about as well as could be expected. Recovering was not easy. There was a lot of pain to work through the first week or two, and dealing with that and dealing with diet and getting everything working again. But I've been back on track, and really, I think I'm healing up really nice now, which is great news. I haven't posted in a while. I've been holding off posting because I've been waiting for my pathology results. I've been waiting until I had this image in my mind. I was going to hear back, and it was going to be great news, Brett, you're cancer free, go on with your life, you're all done, celebration. And I was so excited. I was ready to what I was going to say, and early detection is great, and blah, 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 which it is still, because it's still somewhat early. But I finally got my pathology results back on 4 days ago, on Friday, 4 days ago. And all the margins are clear. Everything when you took it out was cancerous. All that's gone. They're very successful in getting everything out. They feel like it was isolated. The tumor was a T2, meaning it had moved into the wall of my colon, but it hadn't gone through it. It had not moved into any other organs. It had not moved, but they tested 23 lymph nodes that were removed with the blood supply. And out of those 23, one of them came back as having cancer in it, which potentially means there's cancer traces of it floating around my blood right now. So because of that, I was finally given a stage 3, which sounds crazy, but to me, there's a huge difference between 3 and 4. 4 means it's spreading, it's active, it's starting to do a lot more damage. Stage 3, mine was contained, but there's a possibility it's in my blood. So because of that, it's been recommended that I do chemotherapy. I wasn't expecting that at all. That was probably my biggest fear of all of this was having to do chemo. I saw my mom suffer, I saw my grandfather suffer through chemo. But at the same time though, they were doing chemo to try to cure the cancer, to fix the cancer. Whereas mine, the cancer is gone. The tumors, the mass is gone. It's all gone. So at this point, we're trying to clean up. If there's any in there, we just want to catch the traces and kill it so it can't do anything else. So I guess if you're going to be doing chemo, this is the best reason to do it. The most positive reason as far as outcomes. Nobody expects that this is going to, nobody doubts that I'll be able to get through this. That's one reason why they're recommending to me, because I'm still relatively young and I'm very healthy. So they know I can get through it. They know, and by doing it, it'll greatly increase my odds or greatly reduce my odds of it coming back again. Basically, right now, if they don't find any traces of cancer, they're doing blood tests right now, special blood tests to try to match the tumor's DNA with any free-floating cancer in my blood, and match it and see if there's any of that going around. And if they don't find anything, then they're recommending 3 months of chemotherapy. If they do find it, they're recommending 6 months of chemotherapy. But if they don't find it, I'm very low risk anyways for having it return. The odds are 25 to 30% to have the cancer return. But with the chemotherapy, it'll knock it down to like 8 or 10%. And I believe with healthy lifestyle changes, I can push that number pretty close down to 0. So I think it's a really good thing to do for me to do at this point. I'm working with experts, and this is what they recommend, and so I'm going to go for it. They did give me a couple of options for treatment, which is nice. I could kind of help decide my chemotherapy program. They gave me one option which is more convenient, and one option that is less side effects. And I went for less side effects, man. That's what I'm dreading. So I could do. I chose one that's called FOLFOX. It's basically I go in every other week. I go in for a 2-hour, basically IV of one drug, and then they have another drug that has a slow drip for 46 hours, and I take it home. It's a little unit, and because of that, they're going to give me a port. They're gonna surgically place a port into here, which is good for two reasons. One, because a lot of the IV drugs, if you're getting it through your extremities, it can really wreak havoc on your veins, the chemo drugs, and it can really, I mean, it can cause neuropathy and problems and like burning, and and this way, the port will basically have it's under my skin, and it's just a spot where they can just plug in and like an IV, and it'll go right, have a tube that goes right to a main vein. So it's right in direct blood supply. It moves quicker. It's less time sitting there touching everything, so it can just really spread through my body a lot faster. So I'll do that for 46 hours, and then the first time or two, I'll have to go and have them take it out. But after that, if it's going well, they'll show me how to just take it out and cover it up, and it just heals itself back up. It's interesting though, because I do have to get a surgery to get that put in. So I'm going in a week, and I'm getting that installed. It's quick. They put me under, they surgically put it in, cover it up, and I come back out. I think I'm under for like half an hour or something. It's really quick, really light. I'm getting fentanyl again. Fentanyl is such a weird thing to say, but it's used in surgery, so I'll be getting a little bit of that to knock me out, and whatever else they put in my cocktail. And then I'll have this port there, and the nurses were very excitedly told me that you can keep it for 5 years if you want. So if you need an IV, anything, just go and do that. It's really easy. No more IVs in your hands, but I don't know. We'll see. I don't know if I want a port in me, because it's like a lump. It's physically, it's like right there and under the skin. It's weird. I always thought it was something that sat on top, or it's just, no, it's under the skin, and it's kind of weird. I don't know if I want to leave it there for 5 years. So if I get through this and everything's fine, I'm like cancer free, pull it out. But we'll see. Probably depends on how often I have to go in for testing and stuff. Anyways, so I've processed this. I'm feeling, this was some hard news to take. When I was in there meeting with the medical oncologist on Monday, and she told me it was stage 3, I kind of went white for a second. Just the blood drained from my face, because it was so weird. It didn't change anything, but just that number. You hear that number, and it sounds like a. I mean, it's not a death sentence, but it's like, it's scary. It's a scary number to hear. But they're all still very, very, very positive that I'm going to get through this okay. And with the regimen I'm doing, hopefully I'll only have a few down days every other week, and the rest of the time I'll be, I can live life and go about things and live normally. I'm sure I'll get progressively tired. I may have hair loss. I don't know. Maybe some people get it. Some people get nausea. On the 2 options I had, the other one was like get IV once every 3 weeks. Then you take 8 pills for 14 days straight. Then you have a week off. But so there's like 2 weeks where you're just sick. It's like, screw that. Yeah, like 2/3 of people on that one get nausea and vomit, and only like 30% of people that do this one have reported nausea. So I like those odds a lot better. Should be easier on my system in general, and hopefully it's just 3 months. If it's just 3 months, I think I can, 6 treatments, I think I can get to that without too much problem. And that should go by pretty fast. If it's 6, I'll deal with it, and I'll go with that too, because at the end of the 6 months, I'll be in a really good place for moving forward and being healthy and feeling better. One interesting thing, so I thought, I've been talking about early detection all this time, which it was because I didn't have any symptoms. I really didn't have any symptoms. I've had a lot of fatigue the past couple years. I never saw that as a symptom. I thought it was after I had COVID a couple years ago. The second time, I was tired all the time. I thought it was like long COVID. Thought I was getting older. I don't know. But I've been really fatigued, and they determined that I had my tumor. It's been in me for, they think probably a few years, maybe 3 years or more. which is crazy because it missed detection on some of the stool tests I did. I mean, I didn't take one for 2 years, which is my fault, just bad. But I took one 2 years ago. It didn't detect anything. So this one did. So I went to colonoscopy. So that's all the more reason why you should get a colonoscopy when you're 45 now, because the stool tests don't always pick it up. And I didn't have any symptoms. But looking back now, I did have a lot of exhaustion, fatigue, and I'm really hoping now that this is done, that when this is all over, I'm going to have more energy back than I've had in years, and I'm going to feel better and more active and just kind of get back something that I lost, which I thought was aging. I think now I think a lot of it was the cancer. I've had it in me for a few years, and it's been wreaking havoc on me. I'd be fine for a week, and then like every other week I'd spend a couple of few days where I was just tired. I felt like I was getting sick, but I wasn't getting sick. I just felt like I had the tiredness, like I was getting sick, and I thought it was long COVID. I didn't really know. I didn't have any other indications that it was cancer. So basically, next Tuesday I get my report in, and the following Monday, the 12th of February, I start chemo. So it'll be every Monday for 6 sessions over 12 weeks. And it takes about 4 to 5 weeks to get my results back from the blood to see if there's the testing for any free-floating cancers in my blood. And at that point, I'll know whether I'm going 6 months or if it's going to be an easy 3. And I say easy because I'm keeping positive. Some people have a hard time, some people don't. I am healthy. My body's still strong, and I know I'll get through it. So I'm just hoping that it's gonna. Do all I can. I'm gonna follow all the things, do all the recommendations, and the diets, and as best as I can. I know eating can be hard sometimes, I guess, and just do what I can with fluid intakes and nutritionally and with vitamins and things to really try to boost my system so I can get through this all. So that is my update, and I'll keep everyone posted. All right.